Kitchen, KC.
Colorectal cancer rates have actually declined over the past few decades, driven by more screenings and changing lifestyle-related risk factors. And Dr. Sabrina Kidd, a colon and rectal surgeon at St. Luke's, joins us now to discuss the importance of screenings and the latest advancements in colorectal cancer treatment. Thank you for joining us today.
Thank you for having me.
Absolutely. So let's go ahead and dive in and talk to me. Are you guys seeing the rise in colorectal cancers in younger adults?
Yes, we are seeing a definite increase in colorectal cancer rates in those under 50. Unfortunately, we're seeing patients as young as 20 or 30. And when these patients are diagnosed, it's often at a much more advanced stage.
What factors might be contributing to this trend with younger adults?
We think the Western diet plays a large role in this. Anything that can cause an inflammatory condition in the body is likely to increase the risk of colorectal cancer. That includes processed food, red meats, processed meats, high sugar foods, high fat foods, increased alcohol use. All of those increase inflammation and may increase the rate of colorectal cancer in young adults.
What would you say maybe then are some signs that someone might need to talk with their doctor about getting screened?
Definitely, if anybody sees blood with their stool, they need to be checked out. It could be simple as something like hemorrhoids, or it could be something more complex like colorectal cancer, but only a physician can really evaluate and tell that, so it's really important to get checked out. Some more subtle signs may include weight loss or a change in your stool patterns. Anything unusual, it's really important to talk to your physician, and you may need a screening.
Yeah, you definitely need to keep that line of communication open so you can get ahead of it. Now, screenings are the best way to catch cancers early and help improve patient outcomes. What are the current guidelines for a routine colonoscopy?
Yeah, colonoscopy remains the gold standard for screening for colon and rectal cancer. However, in recent years, we've lowered the age due to this increased rate. The average risk screening age is now down to 45. And if anyone has a family history of colorectal cancer or of advanced polyps, they may need to be screened even earlier. So again, it's very important to talk with your regular physician to determine when you need to be screened.
Absolutely. Now, I will say we do see more and more at-home tests. Are these beneficial for people to use, or would you say it's best to stick with that screening colonoscopy?
The at-home tests can be beneficial. They're much better than they used to be. If one does come back abnormal, you may need a screening colonoscopy. But if you're of average or low risk, you do not have a family history of colon and rectal cancer or a personal history of polyps, then this might be the right test for you.
All right. Well, what are some of the latest developments in colorectal cancer treatment?
We've definitely made some advances. And surgically, we've made advances in minimally invasive surgery. That means doing things laparoscopically or robotically through smaller incisions. This decreases the recovery time for patients and also improves their outcomes overall. We've also made a lot of strides in what we call multidisciplinary care. That involves often using multiple modalities, which means chemotherapy plus radiation plus surgery. And when we combine all of these modalities, patients often have better outcomes overall.
Well, that's great to hear. Thank you so much for taking the time to join us today and share this information, because again, it's great for people to hear it and then take that step to just communicate with their doctors as well. So thank you so much.
Thank you again for having me.
Absolutely. And guys, to learn more or to schedule a screening near you, you can visit stlukeskc.org/GI cancer.